Good afternoon, everyone, and a very warm welcome to the second day of this Mixtures Symposium, workshop, should I say. We had a very enjoyable time yesterday, and I hope you enjoyed the breakout sessions. We have a lot to get through today, so I'm going to go straight to our first breakout session, Group 1, and ask Emanuela to present on behalf of Group 1. Thank you, Emanuela.
Hello, good afternoon. Thank you, Heather, for the nice presentation. I think that I need to go immediately to report about our discussion in the breakout session 1 in the discussion group 1. And I would like to ask to thank all the participants because we had a very fruitful discussion. Let's say that in order to answer to the first question, what we established from the very beginning was that the starting point is that we were discussing the grouping of chemicals within mixtures as requested by the component-based approach, and we are not considering at all the grouping of different mixtures. And starting from that, we analyze the flow chart that is depicted in figure 1 in the draft document. And we immediately start to discuss the implication for the data generation and the mechanistic data gathering. Why we did so? Because there was the observation that by using the top-down approach that was included in the draft document, and which was noted is the opposite used so far in all the other frameworks, that was the bottom-up approach, could result exactly in the opposite intention we had at the very beginning by drafting the document. Because as the flowchart is now, why should anyone be stimulated produce the mechanistic data, that means data on the mechanisms of action or depicting the RP, if in any case a common adverse outcome would need to be included in the assessment group anyway. And this was mainly due to the fact that, as it was noted by the panelists, the pathway going to the adverse outcome box is the same independently on whether the results of the common mechanism of action or AOP is known to be different when the answer is no, or if this is unknown. And this point needs some consideration. Sorry, I have to use the clicker, and I don't know why the connection was lost, so I need, oh, you did it, thank you. Regarding the mechanistic data gathering, we wanted to highlight that maybe the best way is to distinguish between the data-rich chemical, for which in vivo data are already available, for example, regulated products, and data-poor chemical like natural toxin that can be the contaminants in the food chain. And for this reason, a new scheme has been proposed. We will see it in a moment. One is a slight modification of the existing one and an additional one as well, to stimulate the use of NAMs in producing RP and mechanism of action information. And we also discuss some quantitative aspects. We try to evidence that whenever chemicals sharing different MIE and converge later in the AOP pathway, it will give additivity only when the biological threshold is triggered and it is exceeded. And it should be exceeded by both chemical, if it is a mixture of two, or by several chemicals, if it is a more complex mixtures. And we intend the biological threshold for the AOP and not the NOEL, and this was underlined. It was also underlined that the identification of such a threshold is not easy to be measured experimentally, because usually in the experimental setting, everyone tried to use some active concentration in order to see the results, and therefore concentration above the threshold are usually used. And another point that was highlighted was that the kinetic information like bioactivation or absorption giving rise to systemic exposure are prerequisite of all this kind of discussion. We also discuss about the uncertainty, because in the original graphs we have an arrow going from the top to down with increasing uncertainty. And this was especially true when you cannot quantify the assessment, the uncertainty, and the level of knowledge of different components in the mixture is highly variable. But it seems that the group doesn't support the use of an uncertainty factor for predicting mixture effects, because there are many documents, including EFSA and the Euromix one, addressing this point. And what another point we discuss is about if this is part of the grouping, or if it is uncertainty of the evaluation and therefore should be discussed at the very end of the process and outside the grouping. So this is the new proposal for the existing flowchart in which the known and the unknown and the no answer for the common MOA AOP were divided. And this is the new proposal for a possible additional chart, mainly for data poor chemicals. Unfortunately, in 10 minutes, I cannot go and give the details of this, but as you can see now, the use of NAMs can give the information, the mechanistic information that are necessary for those chemicals for which in vivo data are not available, because they are data poor chemicals. To answer the second question, we focus on toxicokinetic data. And we ended up with the fundamental statement that TK data are essential, but should not be used in isolation for the grouping. So they can be relevant at any level in the decision tree, and we don't have to forget that bioactivation is also often an upstream event, and can be a part of the mode of action. For example, there are many possibilities that the bioactivation is actually the key event in the mode of action, because if the active metabolite is not formed, you have no chance to get an effect. And again, we stress that some PK data are actually a prerequisite for the effect to occur, because, for example, in the absence of any absorption, no systematic exposure occurs, and therefore it can be used also, this information, to refine the grouping, because at a certain point you can exclude a chemical from a group because it cannot be absorbed at all. It was also highlighted that to take into account this kind of information, the EPA actually includes EP to the AOP, and the will consider the essential TK data as well. And another point was that TK data are pivotal to identify interaction, but this is obviously outside the grouping, and therefore we don't need to discuss it during the workshop. For the last question, we analyze which are considered the data gap. And the first point was that the knowledge of both AOP or mechanisms of action is often not available, or sometimes in complex mixtures is limited to few components. And therefore, there is a very different level of knowledge for the different one. The use of in silico tools or in vitro system can lead to lack of quantitative information. Adequate test system, study design, and possibly modeling like the quantitative in vivo to in vitro extrapolation are needed. And this is another data. So the other point is that NAMs can be used for the identification of the AOP, but it is fundamental that biomarkers of adversity are known and available, and therefore we introduce the fact that also the toxicodynamic information are important and needed. And the last point, it was noted that species differences are very important, and information on species other than human are not available. This is particularly important for EFSA, and in this sense, the development of PBKD models are needed. With this, I think that I managed to stay in 10 minutes and to present our lively discussion. I hope that I have stimulated a bit the plenary discussion. And with this, thank you for your attention.
Thank you very much, Emanuela. I should have said at the beginning that we will be taking questions in the Q&A platform as we did yesterday. So if you have any points or questions, please feel free to put in points as well as questions into the Q&A platform, and I will be able to address these to the appropriate people. So thank you very much, Emanuela, for getting through all of that exciting information in the 10 minutes allocated. I'm going to move now directly to Group 2. And in Group 2, I'm going to ask Antonio to present on behalf of Group 2. Thank you, Antonio.
Thank you very much, Heather, for your presentation. And first of all, I would like to thank all the participants in the breakout session for their input, the important input, and also to Susan for sharing the discussion, a very nice matter. So please, can you, may I have the next slide, and you can skip it because it is the general question, and we have already been familiar with. And the next one, please. So regarding this challenge to implement the proposed methodologies for grouping chemical based on hazard criteria. So there were a number of points that were raised. First, the AOP and the mode of action are not available for many chemicals, and this was considered and highlighted because this can be considered as an important limitation. And on the other hand, AOPs is on toxicodynamics, but they do not consider toxicokinetics, and toxicokinetics is also part of toxicology. Not always the mode of action is reliable for the critical effects, and also the critical effect may not be directly related to the rest of the mode of action of the rest of the chemicals under consideration. Data-rich substances often don't have the right data for grouping based on AOP. So even if they are data-rich substances, there are more information, but not necessarily this information is regarding the mechanistic data. So in silico methods also may have important data gaps to feed the AOPs. So this was considered that this is not the final solution. The adverse outcomes are not always the most sensitive endpoints, and it was considered the question raised: what are these adverse outcomes or apical outcomes observed in animal study? Are they the best criteria for grouping? And NAMs and other mechanistic methodologies can complement this apical outcome observed from in vivo studies, and this we'll consider later on in the third question. Another question that was discussed was: can in vivo outcomes be connected with in vitro endpoints? In other words, are they comparable for grouping? You can imagine a developmental neurotoxicity in vivo outcome and what kind of in vitro endpoints could be mixed together in the same group. First, look at the adverse outcome and then try to fill the AUP when the information is available. So this means that first of all, we need the apical outcome from in vivo studies, and then we need information or toxicological prediction to fill the rest of the AUP. Another important thing was it is possible to use the biomarkers for biomarkers of effect for the adverse outcome pathways. And the approach proposed in the draft guidelines is valid for intentional mixture, but not for unintentional mixture. Anyway, this was considered already in the guidelines. The AOP approach is the best way to capture potential interaction between chemicals based on the AOP network framework. And anyway, conservative attitude should be adopted when the chemicals are poor. There is the need of no grouping chemical in case that there is no information or not enough information on this chemical. This should be excluded from grouping, but in this case, we really don't know what is the contribution of this chemical to the final chemical combined effect. And in the future, there is a need to assess chemical mixture across regulatory domains. It's not feasible so far, but should be considered for the future. To explore the potential of in silico methods for grouping and chemical risk assessment, because they could contribute in an efficient way, but not necessarily right now. And the heterogeneous information on chemicals in a mixture is a challenge for grouping, because you have some chemical data rich or the chemical data pool, so it's possible to group all of them. And something relevant that was discussed is the probability for a substance to belong to an assessment group. And in silico data can refine these probabilities. And we should think whether the issue of probability should be integrated or at least mentioned in the guidelines. And risk and exposure-driven criteria are for prioritization, not for grouping. The next one, please. And now please skip this slide because it's general. And now, as you can see, we discuss in length the first question, but regarding toxicokinetics and model for grouping, we have provide less amplitude for discussion. So it was considered that plant protection products, they have large data gaps in spite of having a lot of toxicological information, but the toxicokinetic data for TPPs is relatively small so far. It was highlighted the role of PBPK models, the potential to address toxicokinetic interactions. And then modeling can provide useful information in this regard. Anyway, PBPK falls under the umbrella of in silico. And many uncertainties in predicting toxicokinetic, for instance, metabolism and hazard from in silico methods, we have already had. It was discussed whether modeling or data. It is not a dichotomy, modeling versus data, but it's important to make better use of existing data. This is important. And also, biomonitoring data can provide useful information on toxicokinetics. The next one, please. And skip this. Oh, thank you. And regarding the data gaps to apply the hazard-driven criteria, it was considered that the NAMs can fill the data gaps in the near future, not necessarily at present. And the in silico methods can reduce the number of chemicals with data poor information. And an interesting paper was provided, and you can have here the link. There is a need to develop more specific model, particularly PBPK model, instead of general model. And in vitro data can be useful to this end. What kind of in silico or in vitro battery can provide some information for grouping? Not necessarily all in silico method or in vitro tests. There is a need to calibrate the in silico data for a more reliability. And confidence within in silico data only in silico data is not enough yet. Maybe in the long term, because the available experience gained so far is limited. So it's depend on the scenario. So when there is in vivo data rich, there is less need for in silico testing. And in some cases, in vitro data are more reliable than in vivo data. It was acknowledged. So we should be careful on reliability of this method. The regulatory sector is more challenging than the scientific world. Maybe for this reason, NAMs are more accepted by the scientific world rather than by the regulatory world. The omics data may provide more endpoints to derive reference point as compared to endpoints from animal testing. NAMs can generate information much quicker and at lesser societal cost, and this is important, than in vivo testing. So it was considered that NAMs can be used even to take provisional decisions. NAMs can also contribute to fill data gaps in the adverse outcome pathways, not necessarily to replace the adverse outcome, which most time comes from in vivo testing and cannot be reproduced by any other methodology. And the adverse outcome and the NAMs will allow to advance in mixture risk assessment, maybe in the near future, but it was considered not in the present. And the last, the AOPs should be fit for purpose, and the development of AOP was not guided for regulatory needs. So they should have the quality that the risk assessor expects. So thank you very much.
Thank you very much, Antonio. That was great, and keeping to perfect time. I think we can already see that there are some common themes appearing in these two presentations so far. So thank you, Antonio. I will now move directly to the next grouping, group number 3, and Kiki will be presenting for group 3.
Yes.
Thank you.
Yes, thank you very much. Thank you, Heather, for the introduction. And I would like also to thank the members of the working group and also, of course, our chair, Angelo Moreto. So let's go to the first. I'll try the clicker. Okay. So the group decided that was of the opinion that the decision tree is clearly showing that the AOP is a gold standard with the least uncertainty. But still, it represents an exception of having enough data. Usually, we have to work at much lower tiers, such as phenomenological effect or adverse outcome. Other criteria applied in practice, as for example, for flavorings in food and feed, were mentioned also. Criteria such as the chemical structure can be used for the allocation of the substances in a common assessment group. The group consider also that the chemical structure can provide some information. However, the uncertainty has to be considered with caution. NAMs can provide information, but pharmacokinetics, toxicokinetics, mainly metabolism and activation also, should be kept in mind, meaning that the lack of metabolic processes in the NAMs can lead to erroneous results. So let's go to the next. So this is the third. Sorry. Okay. Access to data, as for example in data-rich scenario, it was also mentioned as a point of concern. The organization requesting for a new authorization may not be the data owner for substances with uncertain CAG membership. And the decision tree is mainly applicable to data-rich compounds, as mentioned earlier. In the cases of data-pure compounds, the read-across approach should be considered, taking into account both chemical determinants as well as biological determinants, and the information for NAMs, as for example in silico data, may help for grouping. Meaning that all available information that could contribute to the decision of membership of a chemical in a group should be considered. Yes. And now let's go to the next. Okay. So this was the second question, and the group consider also that TK data can provide information on common metabolites, including bioactivation, useful for both grouping and also ungrouping. TK data can provide information on potential interactions, not expected, however, to have a strong impact on the low exposure levels, for example, for pesticide residues. Metabolism is considered to be critical for both route of excretion and excretion rate. And TK, except of metabolism, TK data is mainly useful for risk assessment and prioritization rather than for grouping. And TK data may be useful in the face of the iterative process to keep or exclude compounds from a group. So the last one, the group considered that there are difficulties in reaching consensus about the proper use of information from NAMs. And the NAMs are endpoint driven, as it was discussed in the group. And the relevant or critical endpoint might escape the NAM target. And for those chemical groups which are well investigated, there are endpoints, any kind of outcome for which reliable in vitro and in silico tools work well, while for others they do not. There are, in these cases, meaning that there are several types of NAMs that have been considered and applied. And effects observed in vitro or in silico, for example, or for EDs, molecular initiating events for EDs, do not provide information in the type of reassurance about the ultimate apical effect. And it was mentioned also that the appropriate battery of tests of NAMs has to be applied in order to derive to a more reliable outcome. That was all from group 3. Thank you very much.
Thank you very much, Kiri. So we will move to the next, but before we do that, can I just remind everyone that the Q&A platform is there for you to interact with the speakers. Please do put your points and or your questions into the Q&A platform so that we can discuss these when we come to the plenary session discussion after all the presentations. So please do check the Q&A platform, which is next to it's on the program on the microsite, and you can see the Q&A, and if you just click on that, you will be brought into the Q&A platform so that you can ask questions or add any points of note. So thank you. We will now move to the next presentation on the hazard-driven criteria for assessment grouping. And this is group 4, and the presentation will be given by Jan Dirk. Thank you, Jan.
Thanks. Well, first of all, I want to thank also the members, all the members of the working group and the members who are present during the breakout for their comments and their contribution to the discussion. I will have to use the clicker. Okay. Well, I have to take out. Some members made a remark that it would be useful to add an additional quantitative evaluation regarding the membership of chemicals to the AOP, AO, or to the overall effect. A remark was made on criteria for inclusion and exclusion. It should be defined. And in this definition of criteria, it should also include information like the chemical similarities or toxicokinetics. There was a remark made on chemical structures to facilitate the effects of a characterization. And it was that the chemical structure and common mechanism could be used as an indicator for mutual OPs and mutual common effects. And it was seen as a pragmatic strategy. There was also a mention concerning the decision tree about the boundaries that some members felt it would be better to introduce a definition which moved a little bit away from the categories as now defined and to use more the binary classes. There was also a remark, like the first group told, that we should use more tools for grouping substances for a common MOA, or even use tools which can point out that the substance is also to be assigned to another MOA. And these kind of tools could indicate whether or not based on the probability, a substance could be included or excluded from a assessment group. An interesting point was raised by one of the attendants who said it was we should take advantage of the fact that we have a lot of databases with information and exploit these databases by using artificial intelligence, which could be applied on chemicals to identify the relationship between other chemicals and to find out whether or not these chemicals belong to the same group. Another point was made that the use of different silos within the regulatory frame, it can happen that chemicals which belong to a silo are being addressed not in another way than the hazard has been assessed in another silo. For instance, pesticides uses different criteria compared to the contaminants. While a substance can still be a pesticide and it can be a contaminant. Harmonization, therefore, is considered necessary if you want to perform mixture assessment, and that needs to be set criteria for mixture assessment for different regulatory frameworks, but also when we are looking for chemicals across these different regulatory frameworks. Okay, concerning kinetic data and models for grouping of chemicals. This was shortly addressed, certainly compared to the first question. Well, of course, TK should address the absorption, including the bioavailability. It should address the metabolism, and it should, of course, include impact on systems like the ZIP enzyme system, and it should deal with the excretions. There are also, like the other groups already mentioned, that it's useful to identify if there's a common effect or a common metabolite or a common metabolic pathway. The third point which was raised is more or less not belonging to the hazard part, but is more the topic of later this afternoon discussion, the exposure-driven part and the risk-driven criteria. The last point was that, of course, the TK could be used for a refinement of groups. So if the substance A and B have different toxicokinetics, they should belong to two different groups. Concerning the data caps, well, of course, already addressed in the first slide, we should exploit information which is available in databases. Such as the dashboards from databases from OECD, the OFT, database from the EFSA, or any other database, so that we can use artificial intelligence to find out if there's a relation between chemicals. It was addressed that there's a need to address the common level and granularity and the definition of effects. For instance, for the organ level, the definition of the AOs and the OOPs. It was mentioned that there's a need, the utility for a better ontology and hierarchy of the effects. There was a wish aspect for a network of effects and key events and OEPs. Different tools, in silico tools, could be used for hazard and for grouping. Grouping can be supervised for a specific effect or generic. Simply based on the chemical similarities. And the last point was raised, although we are looking at grouping of chemicals for mixtures, it was still pointed out that it's very necessary that we still perform experiments for whole mixtures. And that concludes the contribution of Group 4.
So, thank you very much. Again, I would ask people to look at the Q&A platform and to add their comments there. Just before we move into that plenary discussion, I would like to just consider a few general points that are common to all of the groups. So I think it was quite clear that the AOP and MOA are not always available for every chemical, and that always provides us with a bit of a challenge. But basically, that NAMs can definitely help in filling the data gaps with data poor chemicals or compounds, but the decision trees need to be reconsidered perhaps to include this a little more. Clearly, in silico can help decrease the number of chemicals with poor information, and it probably can also help with grouping. And one of the points that I thought was quite important was that the decision trees are really very much more helpful when you're dealing with data-rich chemicals than if you're dealing with the data poor. So toxicokinetics is also very important, and we're looking for perhaps common pathways and common metabolites that might help. And we need to understand the degree of granularity that we have in the information available. So now I think we will ask all of our 4 presenters, so Emanuela, Antonio, Kiki, and Jan Dirk, to join me on the platform, and we can start the discussion. So I have a number of points already raised, so perhaps I can start with Emanuela. So Emanuela, a point that was raised was that a participant disagrees with the interpretation of the decision tree for grouping. Requirements to include go from maximum data needed, in other words, an AOP, to the minimum data required, which might be a common target organ. In each case, there is a basis for inclusion. I wonder if you'd like to come back to the questioner on that point.
Yes, it is correct, but every box should have the possibility of inclusion and exclusion. And in the case of the AOP and mechanism of action, there was inclusion in case the experimental data can demonstrate that the AOP or the mechanism of action was in common between the chemicals to be included in the group, but there was no distinction in having the information that with a certain degree of certainty can indicate that the mechanism of action or the AOP was totally different or if it is unknown. So this was the distinction that was made, because if there is no difference between the two different situations, there is no need to explore a little bit more, because the outcome would have been the same at the very end. So that's why we try to distinguish the two different possibilities.
Okay, thank you. So perhaps I could come to a point for everyone, and this is, what solution do you think is possible? For what solution do you think is a possibility that mechanistic data may not be produced if the common assessment group will in any case be formed based on apical effects? So what's the possibility that mechanistic data may not be produced if the common assessment group will be formed based on apical effects? So can I come to Antonio first on that one?
Yes, thanks, Heather. Well, I think that the idea that is captured in the guidelines is that several chemicals may trigger the same adverse outcome pathway, based on, for instance, because they can interact with the same molecular initiating event and then trigger the downstream event to the same adverse outcomes. Also, it's possible under the AOP network that even if it's possible that several adverse outcomes might occur. So in this case, I would say the spirit of the flowchart is that all those chemicals that share the same AOP or the same mode of action rather than mechanism of action, the same mode of action can be grouped together. If there are some chemical that shows separate mode of action, this means that this chemical can be grouped in different groups depending on what we want to assess. So we may have several groups. A single chemical may belong to several groups depending on what is the assessment we want to perform. And also, in the case that we have some chemicals eliciting different adverse outcome by different toxicological pathways, well, we can both possibilities. If in case of toxicological rich data, we can group based on mode of action AOPs, or we can also group by adverse outcome, common adverse outcome. So I think it's depend on the specific case that should be considered what is the methodology to apply to fit best to the current data.
Yes, absolutely. So can I now take the same question? So the question is, what solution would you see for the possibility that mechanistic data may not be produced if the common assessment group will be formed based on apical endpoints? So Kiki, can I come to you for that one?
Yes, I don't have so much to say in addition to what Antonio already said, but I think that it will be important also to focus on the specific case, on the specific regulatory framework that we have to consider, and also on the protection goals that will be set by the risk managers. That's
okay.
Yeah,
Thank you. And Jan Dirk, can I ask you the same question, please?
Yeah, you can ask me the same question, but I'm afraid that my knowledge of toxicology is too basic to answer this kind of question. I am mainly an exposure assessor in this part of 4 people. I'm sorry, I cannot help you on that.
No problem. I'm sure there will be questions for you at some point.
Yeah,
So,
tomorrow.
Emmanuel.
Coming to the same question, I think that Antonio picked up an important point that it depends on the data available and on the cases that you have in front of you. In some cases, you have enough information that can allow you even to discriminate based on quantitative data. But this is, let's say, a situation which is quite rare because it means that you know a lot also about the biological threshold of the key events, and you know a lot about the internal dose and the kinetic of the chemical. So again, this is something which is usually relevant for data-rich chemicals, and it actually depends on the data that you have in front of you. And I think that there is not a unique solution, as in many cases there is no solution fitting for all the purposes, and you need to evaluate case by case.
Okay, thank you. So I now have a question for breakout group 4. So Jan Dirk, please. Why would 2 substances with different toxicokinetic properties but the same AOP be attributed to different groups?
I'm sorry, I have to also to say that it was raised by one of the attendants that the tools could be used for that, but I have no toxicological background to answer that question. Again, I'm sorry, I am an exposure assessor.
Yeah, no problem. Would any of the other panelists like to take that? So why would 2 substances with different toxicokinetic properties but the same AOP be attributed to different groups? Anyone got a thought on that?
If I may, can you hear me? Yeah. I think that, yeah, thank you. If I understood the question correctly, I think that 2 substances may share the same AOP for a specific adverse outcome, but there can be other adverse outcomes and different AOPs also at different dose levels or even at the same dose level. So these substances can be grouped in different CAGs at the same time. That's my understanding. Thank you.
Okay. Other thoughts on that, or shall we move to the next one? Okay. Let's move to the next. Sorry. No. Let's move to the next one. This is a question for Emanuela. It's substances without AOP information should not be excluded from the group, since a shared adverse outcome has been shown to be relevant for combined toxicity. And this is related to the draft guidance, so someone has commented on that. So substances without AOP information should not be excluded from the group, since a shared adverse outcome has been shown to be relevant for combined toxicity. Would you like to comment, Emanuela?
Yeah, if you don't have the information about the AOP or mode of action, then you have to go to the next level, which is the common adverse outcome. And I don't think that you can a priori establish if this adverse outcome is relevant or not for the combined exposure. If you can demonstrate that the combined exposure is plausible, I mean, it can occur in the real life, and so the two substances have the same adverse outcome. If you don't have any other information, they should go in according to the flow chart. They should go in the same group, unless you want to produce some specific mechanistic data, and this was exactly the intention of the flow chart. If you produce more data, and this data can give you the information that the mechanism of action or the AOP is different, then you can decide that they will not be together in the same assessment group, and you can refine your assessment group according to the mechanistic data you have available.
Yeah, yeah. Jan Dirk, please.
Yes, I want to add some comment on that. Although we are now talking about only the hazard part, the grouping is also relevant for substances which we will think that also have an important impact through their exposure. So we have this prioritization that we are talking about later on today, which could lead to an exclusion of this kind of substances. So you can do an extensive investigation on toxicological information on these kind of substances. But in the end, if the prioritization scheme shows that these substances will not be relevant in a co-exposure or do not have an exposure based on its own critical effect, for instance, then the thought of it is that you would not include them in the assessment group. And that does not mean it should not belong in there, but the thing is that it will not contribute to the overall cumulative exposure.
Kiki, I think you had your hand up too.
Yeah, yes, thank you. I would just like to mention that as it has been shown in the Euromix project, and it's clearly mentioned also in the draft guidance, that even substances with the same adverse outcome, which do not share the same adverse outcome pathway, it seems that they can be combined, and the dose addition model is valid for substances that share the same adverse outcome with different adverse outcome pathways. There are data showing that from the Euromix project, and clearly mentioned also in the draft guidance.
Okay. So we have a couple of comments in the Q&A. One is that I would agree with Group 1 that a NOAL is not a biological threshold, and responses seen from combining substances with dissimilar AOPs at NOAL levels do not necessarily reflect the nature of the responses that would occur well below NOAEL levels. So just a comment there. There is another question which I would address to all the panel. So what additional studies on mixtures will be most useful to improve the CRA
Not easy to answer, I should say, because again, it depends on the nature of the group and how many chemicals are there, and try to understand which are those chemicals that are more relevant. As Jan Dirk pointed out, we are just discussing the hazard-driven, but you have not to consider to take the hazard-driven criteria in isolation. And I think that all the methodologies to refine the grouping would be really useful.
Other comments from the panel on what additional studies on mixtures might be helpful?
If I may.
Yeah.
Thank you. I think it's a really difficult question. And in my opinion, it depends on the common effect we consider for each group. And also, in this case, we should try to find out a new methodologies for the identification and evaluation of the common effect for each common effect, and base our grouping on that. But I'm afraid that it's not for the near future, based on what we have available.
Yes, it will take some time. Exactly. Emanuela.
May I add something? Yeah. Listening to Kiki, something came to my mind that a plethora of different in vitro studies are going on at the moment. But I think that what should be quite clear is that not all the data are of sufficient quality to be easily used in the risk assessment. I think that what we need really is good quality data coming from adequate in vitro methodologies. As Stephanie yesterday shows, there are very promising systems that can give you a good answer to the question of which kind of effect is produced, but they should also consider to include the biokinetic model measurements inside the in vitro studies, because without this kind of information, also the development of quantitative in vitro to in vivo extrapolation, that should be something really useful in the future, and which can be used even today. We have a number of this modeling or PBK modeling, but sometimes we don't have good data to be used as input of this modeling. So the message, I think it's really important, quality data are the major request at the moment.
Add something
Please,
here.
continue.
Yeah, thank you. Yes, I think it's important to keep in mind that the general picture of the available data. So for many chemicals, and particularly for regulated products, we have the regulatory toxicology studies, which provide a lot of adverse outcome, mostly in animal models. So based on this, you cannot apply the AOP pathway. However, now we have available in silico technology and in vitro technologies, even with the human cells line, that can provide all the intermediate key events just before reaching the final apical outcome. So it is not a matter of replacement of the animal studies of the animal data, which provide only apical information, apical outcome. It's just to complement all this information from the mechanistic point of view. And under this framework, I think that regulators will have more information from the available data to complete the general picture of the mechanistic pathway. But I think, and maybe most of you would agree, that in the near future, regulatory risk assessment will be focused on mechanistic information. And now all these technologies are available, so we need only to have more data to fix. So it is not a matter of animal data for apical outcome or in silico or NAMs. It's just to put all the available information and integrate all this information.
Exactly. I think it's the problem is integrating all the data as we see it, and not trying to put data into silos, which I think was another point that was made earlier on today. Yeah. So I have another question or another comment here. So it's easier to see how one could group chemicals that share a common mode of action, and indeed NAMs can help with that. But how should one view chemicals that don't have a specific mode of action and are of low toxicity potential, and where little or no in vivo or indeed in vitro NAM activity will be observed? So it's easier to group chemicals under mode of action, but when you have chemicals that don't have a mode of action, specific mode of action, and are of low toxic potential, where there's little or no in vivo or indeed in vitro activity to be observed. What do you think about that? How should you view those chemicals? Antonio, please.
Yes, well, I think that we can follow the flow chart, which in this case, the gold standard is mechanistic information, mode of action, AOP. We don't have this information. We go down to the common adverse effect. And we don't have this common adverse effect. So we can go down to the common target organ or common target systems. Even if in this case, this information is not available, we cannot proceed with grouping, or we can try to test in silico methodologies to apply in order to provide some information that might be useful for grouping, taking into account the potential uncertainties. Even in the case that we have absolutely no information at all, we can group. So the substance is aside from any potential.
Yeah. Other comments. So we'll start with Yander, then we'll go to Emanuela, and then Kiki.
Yeah, my question would be, why do you want to include such a substance in the first place in an assessment group if it has low potential for toxicology?
Yeah.
And if you would just simply look what its exposure is, and that is also very low, it's not expected to be important in a co-exposure with other substances. And it would, in a prioritization, would drop out. So therefore, I would not put energy in finding out information for substance. I would certainly put energy in substances who really are important.
Yeah.
So I would not consider them.
I think that's a good point. Yes. So we have Emanuela and then Kiki. Yeah.
Thank you. Actually, Jan Dirk anticipated the first part of my comments. If you already know that the potential for toxicity of this chemical is very low, I don't think that it will impact on the group that much. But in case you don't have in vivo data and you know that you don't know anything about the potential for any hazard, I think that by using the additional flow chart that the discussion group 1 provided can be of value, because by just using NAMs, that is in silico or in vitro methods, you can try to understand the belonging of a chemical to a specific group. So let's say that there is the possibility to do it only using NAMs.
Kiki.
So my comment was exactly the same as Jan Dirk mentioned, and I think that such substances, there is no reason for them to be considered in the common assessment group. However, even if they are not so of totally low toxicity, and we have some concerns about them, then we have to go for the third method that is going to be discussed this evening. It's a question about the exposure-driven approach. So if we have coexistence of these substances, yes, we should try to get more data. If we do not have coexistence of these substances of low concern, of low toxicity, then we shouldn't consider them in grouping. But I think it's a discussion for this evening. It's not for the first part.
I think you might be right. Yes. So I do have a question, which I think is a very loaded question, but I'll ask it anyway. It says, when talking about NAMs, including in vitro data, the views are quite diverse on how extensive these data have to be to replace animal data. So I wonder if you have any comments on that comment. So it's, how much is enough, or how extensive do NAMS data have to be to replace animal data? And you might want to take issue with the word replace as well. Anyone got any views on how extensive? Yeah, Antonio,
yes,
please.
Yes. Well, I think it's not a matter of replacement the data. I think again it's a matter of complementary data. So under the current risk assessment paradigm, we have animal data and we can complement this information with in vitro or in silico or any other line of evidence, because the final output will to integrate all this evidence. If we are talking about the future risk assessment, in this case, of course, that in the future, these NAMs might have the potential to replace animal data, but maybe not necessarily in these days. Thanks.
Yeah, I think that's the point. We're not replacing like with like, are we? It's not replacement. I think replacement is the wrong word. It's complement. It's much more. Yeah. Other views on that. Please.
If I may add something, thank you. I think it's very difficult to say now what will be needed, either to replace or to complement. My understanding is that for each endpoint we want to have information. We will need a battery of tests of NAMs that will be suitable for addressing the different questions in an approach similar to what we have already for genotoxicity, for example, where we have a battery of different tests in order to be able to address the genotoxic potential of a substance. This was also the discussion from the group 3 that we highlighted also that a battery of suitable tests will be needed for NAMs for each endpoint. But still, it's too early.
Exactly. I think that's a very valid point. Yes. Emanuela.
I think that you cannot say absolutely this is enough. Enough is when you can take a decision, an informed decision. So in some cases, you have to think to a battery. In some other case, you can even think to a total replacement. And I think that some of the OECD test guidelines that are already adopted can demonstrate it. And one of the best examples in which the AOP and the mechanistic information have been crucial in order to have some different tests able to, let's say, replace when the data obtained are looked and integrated one to the other, is the skin sensitization, in which the process has been divided in different events and different tests for each of the event, starting from the molecular initiating event, going down to the downstream, have been developed and can be used now to replace the animal. I mean, if you think this way, we can go farther, and but it is not the same for any endpoint, and sometimes the situation can be very different. Although I agree with Kiki that a single test will not replace the animal. A single test is not useful in isolation. We have to integrate all the data as much as possible. And for this reason, and to include all the TK information, which are really relevant for the systemic effect, we should think to having modeling available. Otherwise, we will not be able to use all the NAMS data that we have.
Yeah, I totally agree. I mean, I think we will be trying to use all the data sources that we have in terms of batteries of tests or whatever, just so that we can have a full picture of what we can see toxicologically. But again, I think it's not about replace, it's complementing the data. And there is a comment here which I'd like to read out, and that is animal data can well provide mechanistic data. And the comment is, think about genetically modified strains. So I think that is a very useful comment, because you can, if you like, derive extra information by using genetically modified animal strains as well. So it's an interesting comment. So there's also a comment here about chemical similarity. A comment saying that chemical similarity needs to have a clear definition, because what does similarity mean? Chemicals may look similar to one person, but not to another. So again, I think that's just a shout out for ensuring that clarity in what we do is available. So a comment that's, oh, sorry, Emanuela, please come in.
I think that for the definition of chemical similarity, there are already quite clear documents from the OECD and even from ECA and REACH for the application of the read-across principle. In that case, the similarity by using whenever possible good in silico methods, which are within their applicability domain, and possibly more than one, is one approach. And in case there are also some bridging studies, this would be even better. But we have already guidance on the chemical similarity.
Yes, thank you for that reminder. Yeah. So there's another comment here, and it's about the issue of potency being underestimated. The default procedure to consider all members equal because of the lack of data is insufficient. So I think that's a very topical one, where there are lots of examples, the aflatoxins, for example, where they're all treated the same, but we know that some of them are more toxic than others. So the issue of potency is underestimated. Do you have any considerations or thoughts on that?
One first comment is that these draft guidelines are only for grouping, and not for risk assessment of chemical mixture, where the potency factor might be considered. And a second remark is that even for cumulative risk assessment, EFSA have already produced a number of scientific reports and based on the total margin of exposure. And in this case, you don't need the potency factor. And there was some mathematical demonstration for that in this scientific report from EFSA. Thank you.
Thank you. Okay, so moving on. This is now relating to the presentation made by Stephanie Bopp yesterday. Taking the presentation of Stephanie yesterday into account, synergism and antagonism don't seem to occur often, though it might still be very important in some cases. The question is, in the current framework or decision tree, is there a way to take synergism and antagonism into account?
May I?
I'll come to Emanuela first. I'll go to Emanuela first because they made some suggestions about alterations to decision trees, which I hope we will be able to come to during this discussion.
I don't think that this is in the remit of the document, which is just on grouping. The interaction is something that has to be evaluated after the grouping. And for this, kinetics is absolutely important because most of the interaction, both the synergism and antagonism, are driven by the kinetic behavior of the chemical. But it is not for grouping. Once you have group and then you have to evaluate, you take into account the possible interaction and the potency as well. So this is something that is outside the remit of our discussion, and it was not discussed in the grouping document. Because this is something that has to be considered afterwards.
Okay, Kiki, I think you had your hand up too.
Yes. I absolutely agree with Emanuela that the issue of synergism or antagonism has not been taken into as a part of this draft guidance document. It was outside the purpose of this guidance document. And when we decide about a group, then we have to, it's, let's say it's the next step. And then we have to check if we have any idea or indication of either antagonism or synergism of the specific compounds in the group.
Thank you. Any other, Antonio?
Yes, in some another remark. So absolutely agree that this is outside the scope of the grouping approach. And what we can consider is in the case of toxicodynamic interaction, because using the AOP framework at the level of the molecular initiated event, you may group chemical producing an agonist effect on a receptor, or you can group chemical producing an antagonist effect on the receptor, and then you may have two separate assessment groups. The problem is in a second step to proceed with the chemical mixture assessment. This is a risk assessment. This is another problem.
Yeah. Okay. Any further comments on that? Okay. So if I can then go to, again, a comment for you to consider. The risk-based scheme allows for reducing computational demands by pruning out substance exposure combinations likely to have a low effect on cumulative risk, or a low contribution to cumulative risk. An additional way to reduce computational demands that would also increase realism would be to exclude compounds concluded to have a low probability of true common assessment group membership. So does anyone have a thought on that? I'm not reducing computational demands clearly is an issue. What do you have any views on that comment? So the risk-based scheme, yes, please. Please, Emmanuel.
I think that this is something related to the discussion we will have today, because it's a way of prioritization to reduce the number of relevant chemicals which are ended up into a group. So I think that it would be much better to discuss it tomorrow once we will have the results of our breaking out section today.
Yes. Thank you, Emmanuel. I agree with you. I think we could save that one for later for further discussion. There is also a comment here that if we group in the absence of effect, which group is something added to? Which group is it added to? I think we've kind of addressed that point already, because if there is no effect, why would we be considering adding it to a group? I think, but I'll leave the panel to comment. I think I see some nodding. Yeah, we're all agreed in that one. So at the moment, there are no further comments or questions. And I just wondered if it might be possible to go to Emanuela's slides, please, so as that we could have a look at some of the proposals that Group 1 made about using NAMs, for example, and also the altered decision tree, just for comments from the panel. Is it possible, please, to go back to Emanuela's slides and see those diagrams? I'm probably creating a huge fuss, but I think that would be quite nice to go back to that, because it was quite interesting observations on the. Thank you. Yeah. Yeah. So the next one, please. So the point was that there was an unknown and a no, and they both had the same outcome. So if you go 2 slides forward, I think. Another one. Yeah, so here, no, back one, please. So I think this is a nice addition to the diagram, and I just wondered if we could have comments from perhaps groups 2, 3, and 4, what they felt about this change to the chemicals under consideration, the decision tree here.
Difference is that we added, we split the no and unknown from the first box because we missed one of the arrow. It was just no unknown going down to the box of common toxicological effect. So, yes, so we have just split it no and unknown.
Absolutely. Yeah, and I think that's very useful. Please, Antonio.
Thank you. Yeah. Thank you. Sorry for interrupting you, Chair. No, the question is that even if you don't have this information on the mode of action AOP, if you do so, what we are seeing on the screen, you automatically exclude from grouping. And you have another possibility is to go down and to group based on common toxicological effects. For this reason is why we put unknown/no immediately when no information on mode of action is available.
No information is available is synonymous of unknown. When you have the data and you can demonstrate that you don't have a common mode of action or AOP, then you have the data. Let's say but not having the data is covered by unknown.
But even in the unknown, you exclude from grouping, and in those cases, you may have the adverse outcome.
No,
if you have the adverse outcome,
with the unknown, with the unknown, you can group it because you go directly to the common adverse outcome.
Yeah. Oh, well, but if you have no information on mechanistic
No. If
information.
no doesn't mean that you don't have information. It means that you know for sure, having data, that they belong to two different AOP or two different mode of action. Because you have three possibilities. One is yes, knowing the data. One is no, knowing the data. And the other one is no information or unknown or not sufficiently robust data to say yes or no. In that case, you go down and you group according to the adverse outcome, common or not. Because even in the other case, you have yes, no, or unknown. So there is no reason to be different in that box. No means you know exactly on the basis of data that the mode of action or the AOP is different. It's not common.
I shall move to Kiki.
Yes, thank you. I agree with Manuela that yes, by no we mean that we have data, and the data shows that we do not have the common mode of action or AOP. But here we propose to go further down and at the end check for the common target, common organ, or common adverse outcome. And as we know, when we have a common adverse outcome, even if the mode of action and the adverse outcome pathway is different between two substances, the dose addition model applies. It has been shown in the Euromix, and there are publications on that. That's why we put no here and we go further down to check if we have common toxicological effect or common adverse outcome. If it's no, then you exclude from grouping. But if it's yes, then you have to go further down. That's the logic
Emmanuel.
behind this scheme.
Thank you.
This
Emmanuel.
is something that we have this is something we have discussed yesterday. And here is the discussion on the quantitative effect that we consider. Because if two chemicals, and this was one of the points that we put in the slides, if two chemicals has the same common, as different molecular initiating event, but they converge later on in an adverse outcome pathway. Then if you don't exceed the threshold, you cannot have any additivity. And what you notice in the experimental setting, including the Euromix ones, is dependent on the fact that if you want to see something and to have a readout of your experiment, you need to go above the threshold. So you see additivity anyway. But if you think it in a theoretical way, if you don't exceed the threshold, you will not have any additivity at all.
Indeed.
But even again, I would like to remark that even if you don't have information common mode of action, but you have data on the common adverse effect, why there is no need to group based on the adverse outcome? So I think it's a matter of discussion. So
it's a matter of discussion, but
can
again,
you put back
Antonio,
the scheme?
Can you put back the scheme, please, Johanna? Thank you.
So you can see that under the box of common mode of action of AOP, no means that the chemicals don't share the common mode of action. And in this case, you automatically exclude from grouping. But it is possible that even if those chemicals, you know that they don't share the same mode of action, but you can group based on adverse outcome if you have available this information.
So Antonio, may I ask you a question? Why, as an applicant, for example, should I go and produce any mechanistic data if independently on my mechanistic data, you will group the chemical together anyway? Let's say it is not triggering mechanistic data, it's just saying you don't have to produce it because independently on the results, you will be grouped together anyway.
I think that was one of the questions.
This was the starting point. This was the starting point of all our discussion. Why should I produce them? And it is logical.
Yeah. Well, perhaps we might leave that one there because we are short of time now. And I'd like to go to the other diagram from group one. If we could go back, Joanna, to the slides, please, and go to the next slide. Yes. And I wondered what the panel, I realise you haven't had much time to think about this, but maybe perhaps, Emanuela, you could quickly take us through this very, very quickly.
Yeah. The first question,
Can we leave
I
the slide,
may
please?
have the graphs, yes. The first question is, are in vivo data available? Because this was the discriminant. So, I mean, for many chemical, you don't know, for example, which is the common adverse outcome. So if the answer is no, you go directly to the box to perform NAMS or identify adverse outcome or other apical effect. If they can show that they have a common apical effect, then you place it in the assessment. If the answer is yes, it means that you know if the chemical affects a common organ or system, and again, you have the possibility to say no, so that they can be, for the moment, excluded by the assessment group, or if it is unknown, you can use NAM and produce some data. If it is yes, then you can go to the other level of complexity, saying, is there a common adverse effect? And again, you have the possibility of the unknown, and therefore conservatively you place it in the assessment group, or the answer is no, and you can exclude it. If the answer is yes, you can go to the next level of complexity, which is there a common molecular initiating event? If the answer is yes, you can go directly in the assessment group. Or if you want to further refine, you can use the screening about the threshold and consider that you can have the additive information. So only at doses exceeding the biological threshold. So let's say in this case, you start the other way around. You start asking you, are in vivo data available? Telling me that the apical effect is the same, and then go and try to get more information. But there is no push to produce in vivo data, because data can be collected also performing in vitro, in silico, or generally NAMS testing.
Okay, so does anyone have any comments on that? I have a question here. So is AOP MOA simply a lower tier of data in the absence of data on adverse outcome, since compounds will always be grouped if they share an adverse outcome?
In this case, it could be yes, because you don't have much information. But of course, you are stimulated to produce mechanistic data in order to have more reliable and less uncertain grouping.
Yep. So another comment is, So the take-home message is, if you can show that two chemicals have no common MOA or AOP, but the same adverse outcome, the effects will not affect each other. If both are below the threshold, the mixture will also be below the threshold. Now, I think that's probably taking the step too far, but it is a comment. Do you have a view on that?
May I ask,
Yeah, please, Kiki.
what do we mean by threshold? Which is the threshold?
I
Is
think
it
it's the
possible to
threshold.
identify the health-based guidance value, for example?
No. That when you think to a molecular initiating event, for example, think to a receptor, you need to be above a threshold in order to trigger a response. And this is the threshold. The threshold is not the NOEL, it's not the health-based guidance value, it's something different. So it's part of the mechanistic data. I mean, if the molecular initiating event is the bioactivation, if the concentration of your chemical is below the affinity of your enzyme, you will never reach a concentration able to get to the target. So the threshold here is the concentration which trigger a response in the molecular initiating event.
Okay, so I have a comment on the flowchart change, not the one we're looking at just now, but the last one. It says splitting the no unknown around MOA and AOP into two arrows looks very good. But the question is, why do you have an additional MOA AOP box above the first one, the common MOA AOP? It's rather strange, I think, is what the suggestion is. I don't know if we can go back to that diagram, but yeah. Yes, so we have MOA AOP.
Yeah, it can be. It can be deleted, I guess. It was just because we changed it yesterday during the discussion, and there is a duplication. Maybe that the idea was just to identify that the gold standard is to have information on mechanism of action and AOP.
Okay, another comment. Yeah, another comment in the same vein is the flowchart again. By definition, two substances with different AOP do not have the same phenomenological effect. We can resolve this discussion by separating AOP and MOA. So I'm not sure whether that would be effective.
I'm not sure I understand. Yeah, I'm not sure I got it, because actually there is not that big difference between MOA and AOP if you consider the key events and includes let's say the kinetic part, which is relevant for the key event to occur. That is because AOP is mainly interaction with the structure in the cell. That means toxicodynamic, and the only thing that the MOA has in addition is that sometimes the key event is the kinetic part that make the chemical being there at the target organ at the right concentration. It is not just kinetic in general that is taken up by the mechanism of action. But what we discussed yesterday was that indeed kinetics also for the AOP is a prerequisite. So at the very end, there is a sort of overlapping between the two.
Yeah, exactly. So we've just about run out of time, but what I would like to do is to suggest that we make available the two diagrams that we have discussed in the last 10 minutes or so to the audience so that comments can be thought about for further plenary discussions. I hope that will be acceptable. I would like to close this session by thanking our four rapporteurs very, very much for all their input. This has been quite a difficult session for you to answer questions off the top of your head. So thank you all very, very much. We will now go on a break, and let me just check. That break will be 20 minutes. When you come back, you will be joining your second breakout session. Sorry, I've been told that the break is only 10 minutes, which is not quite what I've got on my sheet, but never mind. So could I say, please, a 10-minute break, and if you could then return to your breakout session for exposure-driven and risk-based criteria discussion. Thank you very much.